Welcome to Psyche Snacks. This is episode 6, and this is the podcast where we discuss mental illnesses and how to help those struggling with them. Today, we will be discussing eating disorders and addiction. So, what is an eating disorder? According to Mayo Clinic, eating disorders affect both physical and mental health. They involve abnormal eating behavior, that is, eating too much or too little, and they can be very deadly as well because of the physical side effect of the physical side of the disorder. And so, of all the mental illnesses, this is one of the deadliest in terms of rate of death. So what are different kinds of eating disorders and their symptoms? So first one, we'll go with anorexia nervosa, or just commonly known as anorexia. And this involves severely restricted calorie intake, which may include certain types of foods, intense fear of gaining weight, distorted body image, some obsessive compulsive symptoms, excessive exercise, and there's two types. There's restriction and binge eating and purging. So the restriction is when you just don't eat anything, and then binge eating and purging is related to bulimia, which we'll talk about after this, and that's where you eat a bunch of food and then you throw it up, and so that you don't have it inside of you. Um, and then uh, that can actually cause teeth problems because of the stomach acid stripping away the enamel on your teeth, and then also swollen cheeks. Some other symptoms are brittle hair and nails from lack of nutrition, thinning bones, and infertility, especially for women when you don't get as much food. As you lose weight, when you get below a certain weight line, your reproductive organs stop working because you need a certain amount of fat around them in order to have a functioning reproductive system. And then also, organ failure and death happens in severe cases. Onto bulimia nervosa, or just called bulimia. It's eating until painfully full without being able to stop, then purging through forced vomiting, laxatives, diuretics, enemas, enemas. I don't know how to say that word. Um, Fasting and excessive exercise. And so the difference between bulimia and the binge eating and purging side of anorexia is eating until painfully full. The fact that the person cannot stop themselves from eating and then purges it. This can result in inflamed and sore throat, swollen salivary glands, worn tooth enamel, tooth decay, acid reflux, gut irritation, dehydration, and severe cases can lead to an imbalance in electrolytes that can cause stroke or heart attack. So, again, very serious. And also, another thing with bulimia nervosa is it's harder to tell if someone has it. Someone who's anorexic will be visibly thin, but someone with a binge eating and purging side of anorexia or with bulimia will actually not visibly look like they're losing weight because of the swelling in their cheeks and in their bodies. There's binge eating disorder, so just eating a lot of food, often in secret, very fast until uncomfortably full, even in the absence of hunger. They don't purge afterward like in bulimia nervosa or the binge eating subtype of anorexia nervosa. And they also tend to eat more ultra processed foods than whole foods, which leads to a risk of heart disease, stroke, and type 2 diabetes. There's pica, that is eating things that aren't nutritious and aren't food, such as ice, dirt, soil, chalk, soap, paper, hair, cloth, wool, pebbles, laundry detergent, and cornstarch. Sometimes eating these things is a part of culture, and therefore it doesn't make it a disorder. Um, this disorder is commonly seen in people with intellectual disabilities, neurodevelopmental disorders, and other mental health conditions like schizophrenia. And these people are at risk for poisoning, infections, gut injuries, and nutritional deficiencies, and this can be fatal depending on the substances ingested. There's rumination disorder. This is when someone regularly regurgitates food, usually within 30 minutes after eating, then re-chews it and either re-swallows it or spits it out. This usually develops in children from 3 to 12 months old and it disappears on its own, but if it's not resolved, it can cause weight loss and severe malnutrition that's sometimes fatal. There's avoidant or restrictive food intake disorder called AFRID, and this is a lack of interest or distaste for foods with certain textures, smells, tastes, colors, and temperatures. Avoidance or restriction of food that prevents the person from eating enough calories or nutrients, and so they might have a very specific set of foods that they can eat because they're used to the texture and the flavor. Um, but they might not necessarily be nutritious, which can lead to them developing some physical side effects, which could be weight loss or poor development for their age and height. Um, Also malnourishment or dependence on supplements or tube feeding. And it's not just picky eating. These people are unable to eat the foods that have the wrong texture, and even if they try, they may throw it up. And again, this doesn't apply to religious practices. That is, people not eating beef or people not eating pig because of their um, religious beliefs. There is purging disorder, so that's just purging without binging. There's night eating syndrome, that is, eating excessively at night, usually after something wakes them up. And then other specified feeding or eating disorder, it's an umbrella term for any eating disorder that doesn't match the requirements for other categories. So those are just some examples for what an eating disorder can look like. What causes eating disorders? Well, the direct cause is unknown, but there's some connections to biology, that is the neurotransmitter imbalance that we've talked about before, and genetics. And something that increases risk of the eating disorder includes having family members with eating disorders, so that is observing family members that have it and learning from that. Other mental health issues can have a side of eating disorders. Dieting and starvation can lead to someone developing an eating disorder. History of weight bullying, so a kid who was a bit heavy set as a child and was bullied for it may internalize that and develop unhealthy eating practices because of it. And also stress. Stress can cause someone to eat too much or too little, or eat malnutritious, no, just non-nutritious food. So, how are eating disorders treated? Now, first let's talk about prevention. So, healthy dieting. That is, if you're going to diet, make sure that it's healthy and you're doing it healthy manner. Some ways you can do it in a healthy manner are um, not limiting yourself to certain foods, making sure that you're thinking in moderation instead of I can eat that cheesecake because it's got too many calories. It's I can eat a small slice of that cheesecake because it makes me happy, and that lets you not develop a toxic relationship with food. And then also making sure that the foods you're allowed to eat are nutritious. Because if you go on uh, I've heard a watermelon diet. It's basically just watermelon because it's got water and it's got melon, I guess. And some people think that's okay, but it doesn't have all the nutrients you need. In fact, it has very few nutrients because you need to have protein, you need to have fats, you need to have carbohydrates, and watermelon doesn't really cut it. And so, making sure you diversify your palate is very important to getting and making sure you're fully nourished. Avoid supplements. So, some people with eating disorders can excuse themselves from eating because they think, I've taken this supplement. This supplement covers all my micronutrients, and so I don't need to eat because, my body will keep working on its own as long as it has the supplements. That's not true. You still need your macronutrients, and those come through eating proteins, fats, and carbohydrates. Getting enough exercise. Exercise is really helpful for you. It's when you excessively do it for the purpose of losing weight because you have a distorted body image, that's unhealthy. And then also, don't get too little exercise because you want to make sure that your body is healthy, and healthy body, healthy mind, healthy life, I guess. It, quote that and put that on the wall. That was beautiful. Also, it's important to treat your mental health issues because, like I said, one of the risk factors for getting an eating disorder is having other mental health issues. And so, if you get treated for your mental health issues, you have less risk of it developing into an eating disorder. And then for children, if you don't want your children to develop an eating disorder, avoid dieting around them because, again, that's something they can learn and see, like, oh, this is something you're supposed to do. But if children diet, that can lead to a damaged psyche, and they may think that they're fat when in reality they're still growing and they have no need to diet at that age. And then also encourage body positivity and positive body image. And a big part of that I remember watching is uh, it's very common for um, little girls to develop um, the same insecurities as their parents, and for little boys to so little girls follow their mother and little boys follow their father, and this is very common. And I saw a heart-wrenching video of kids asking what they're being asked what their insecurities were, and one little kid like, I'm insecure about my legs, and then it would cut to the mother saying that they were insecure about their legs. And that's just sad that the children learn insecurities. And so by making sure that you're positive about yourself as a parent, your children learn from that, and they can learn to be comfortable in their own skin and not develop a disorder that can cause them to destroy the body that they have. And then when it comes to treatment, medications are sometimes used as antidepressants, um, especially to treat other mental illnesses that maybe have led to this eating disorder. Nutrition education, so making sure someone knows what they need to stay healthy. And then also talk therapy, because again, sometimes there's those underlying issues for the eating disorder, and so talking through that can resolve the core of what's wrong. And then as peers, if you see someone who you think is struggling, it's a good thing to learn. You can learn from this podcast. You can look things up. You can learn by reading textbooks, which I like to do because I'm a nerd. And it's important to encourage professional help. Like I said, this is one of the most deadly mental health illnesses, and that's purely because it has that physical side effect, and food is so important to life. And then it's again, as I always say, it's important to listen actively and with empathy because uh, everyone's a person. That's another quote you could stick on a wall. Everyone is a person, and everyone deserves to be listened to. So, on to addiction. How do eating disorders relate to addiction? Well, addiction can sometimes cause an eating disorder. Again, mental health illnesses can often lead to an eating disorder. And also, eating disorders can sometimes cause addiction. Uh, Someone who's dealing with an eating disorder may result to a supplement or a drug that helps them deal with the physically uncomfortable symptoms of their eating disorder. So, what is addiction? Cleveland Clinic says it's a chronic condition involving compulsive behavior or drug seeking, um, despite negative consequences. So, someone may say, like, oh, I'm addicted to cheese. Cheese isn't necessarily bad. I mean, yeah, if all you're eating is cheese, that's an addiction. That has negative consequences. But if someone just really likes cheese and not to the point of it having negative consequences, it's not necessarily an addiction. Not in the official sense, though. So, what are different kinds of addiction? There's substance addiction and behavior addiction. Substance addiction, some examples: alcohol, it's the most common addiction. Um, Caffeine, also very common. Cannabis, hallucinogens, hypnotics, inhalants, opioid stimulants, and nicotine. Opioids is a very sad one I see. Working as a pharmacy technician, because a lot of people, if they can't get enough opioids, they're in a lot of pain, and so they take more opioids than they're supposed to, and then the regulations we have in place don't let us fill them early for them, and so they end up not having enough pain medications, and there's nothing we can do about it. And then also we take all the hate for it because they need their drugs and we can't give it to them, and we're the face of the operation even though it's insurance and the law that's keeping them from getting it. And so it's very sad to see people in pain that are unable to get the substances they need. Um, and another thing with a lot of addictions is that you develop a tolerance to them. And so these people who have been taking these opioids have to take more and more in order to feel at the same level. And so um, it's very hard for them to get off of these opioids, and very easy for them to just start taking more and more in order to feel normal. And then there's behavior addictions. So this has some connections to OCD and bulimia nervosa. So there's gambling, there's eating, there's exercising or dieting, shopping, shoplifting, pornography, sex, and video games, and also the internet. And so, yeah, people can be addicted to their phones. Gambling is also a huge one. A lot of gamblings, especially slot machines, they're specifically designed to hack into your psyche and give you little rewards and flood your brain with dopamine. And then, um, so you have the slot machine before you and you pull the lever and it flickers through and you don't get an award. So you're like, okay, well, it'll be the next one. And then, right when you're about to give up, it gives you a little reward. And that little reward um, lets you keep going. So it's designed to take your money away and take your time away and take your happiness away by flooding you with this short-term neurotransmitter. And the internet is the same way. Often lately I've been hearing the word a lot, doom scrolling. So you just scroll through whatever social media you see and you just do it for however long until you fall asleep, until you have to go to work, until you, I don't know, until you're done on the toilet. And um, it's designed just to give you the short form content is designed for to keep your attention span very tiny. And the thing is, it's not that dopamine is a bad thing. It's just not good in such extreme amounts that we've been given through social media. But I could do a whole podcast on that. Unfortunately, this is the last episode. But if anyone wanted more, I could talk more. I have lots of things to talk about, and I can talk about them. But moving on, what are some signs of addiction? So, how can we as peers recognize that someone may be addicted to something? Well, addiction involves an inability to stop. So, someone may decide to quit smoking but have to go back to it, whether it's because of withdrawal symptoms or just the um, mental relief it gives them. It involves an increased tolerance, like we talked about with the opioids. Same thing happens with alcohol and caffeine. Intense focus on the subject of addiction, so they may talk about it all the time. They may talk to their friends about how they're not getting their opioids because insurance is annoying. Um, and then lack of control, so they might have a daze come over them. They cannot control themselves. They have to take that extra pill of Norco or Percocet because they're in pain and this is their solution to their pain. And then it involves health issues and also withdrawal symptoms. So what causes addiction? Well, it's very complex. We talked a bit about the dopamine hits, but addiction changes your brain chemistry and makes it so that you may seek comfort in smoking because it relieves you and it rewires your brain to when you feel bad, you reach for a cigarette instead of reaching for healthy coping mechanisms like meditation or talking with friends or reading a good book. Uh, the addiction changes your brain chemistry, and your body wants more and more of this thing. There's genetics. Genetics can play a big part. Personally, in my family tree, I have a genetic propensity to alcoholism, so I stay away from alcohol. Also, because I'm too young to have alcohol. There's mental health issues can cause addiction, just like mental health issues can cause eating disorders, and bulimia can be an addiction in a sense. Mental health issues can cause addiction. Um, Environment can cause addiction, so having friends that um, are also addicted to something or friends that also encourage substance abuse can lead to addiction. And then also ACEs. So we've talked about, well, I don't know if we've talked about it in this podcast, but I talked about this in my psychology class and in my social work class. ACE is short for adverse childhood experience, and the more someone there has a very strong link to um, some mental disorders they'll have later in life, and someone who has more adverse child experiences than another may have more propensity to develop an addiction. So you can take an ACEs test online. There's a bunch of free ones, and there's just a few boxes you can check and see how many adverse childhood experiences you've had and how likely it is that you are mentally ill. um, how is addiction treated? Hospital management. So, someone who is addicted to something to a severe degree may be put under the care of a hospital and completely taken off and away from anything that they may be addicted to. This is a very jarring thing and can be very scary for people, but they won't let you smoke. They won't let you take your Norco or your Percocet. Um, some people who are addicted to smoking, they um, they can be given the opportunity to leave, um, against medical advice or AMA, and they have to do it outside. They have to smoke outside because they're taking that risk, and the hospital wants to encourage them not to be addicted to such a thing. And it's cold turkeying any medication, any substance is hard, but that's why in a hospital it's a very safe environment surrounded by a lot of people, and they can make sure that nothing bad happens to you. Um, Addiction can also be treated through different medications. Sometimes the solution to drugs is more drugs, but at the pharmacy we often sell things like scopolamine, nicotine patches, or Suboxone. And what these do, so nicotine helps someone with withdrawal symptoms. They put on a patch that has a certain amount of nicotine in it, and they get used to that, and then they put on a patch with a lower amount of nicotine, and that way their body gets over that physical need for nicotine. I mean, there's still the behavioral aspect of it, like holding something between your fingers. They may put a straw between their fingers and have that be what occupies their fingers. Fidget rings can also help. And then there's other medications like Suboxone, that's buprenorphine, and that medication actually makes it so it's a little film that you put under your tongue, and that way it's quickly absorbed into your bloodstream. And what it does is it makes it so that when you take those addictive substances, it doesn't have the same hit as it would. And so it doesn't, it makes those behaviors less rewarding. And so it helps someone get over that mental hurdle of needing that thing, because that thing becomes less rewarding to them and they can do other things that are more rewarding. There's rehabilitation. There's like a bunch of 12-step rehabilitation programs that help someone go through get over an addiction. There's therapy. We talked about therapy. And there's support groups, so Alcoholics Anonymous, and other anonymous things. And so just other people you can talk to who are going through similar things. You can relate to them and get better with them and create meaningful connections with them, because having a good support system is a high predictor for success in any habit, any recovery, and any mental illness that you may have. And then when it comes to prevention, it's to just avoid any addictive substances, avoid opioids, avoid alcohol and caffeine, avoid gambling, because if you avoid it, then you can't develop an addiction. Addictions are developed. Again, some people may have a genetic propensity, like me, to alcoholism, or a genetic propensity to become have an addiction to smoking. So um, avoidance of the addictive substance prevents that from starting. And then also knowing your family history. Like, I know that I have a family history of alcoholism, so I'm not gonna alcoholism. And so knowing your family history and what you may have propensity to makes you extra wary around that substance. And then also healthy stress management. If you're going through something, instead of reaching for something that's a quick comfort, like, a donut or a cigarette, you can develop a healthy coping strategy of meditation, talking to a friend, or doing any sort of activity that encourages mental health. And then how do you help someone who's struggling with addiction? So you've noticed that your friend Jerry, apparently Jerry's in this. You mentioned that you noticed that your friend Jerry is addicted to cheese. We're bringing that one back. He only ever eats cheese. It's not good for his health. Uh, so how can you help them? Voice your concerns. Hey Jerry, I think you're eating too much cheese, and I think you're malnourished, and I think you need to eat a more diverse palate. Uh, Also, I think you should get professional help because you're eating too much cheese, and obviously this is a mental hurdle for you, and it's not that easy for you to get over your cheese addiction. And it's really important for addictions that the sooner they get treated, the better. Because again, addiction often goes with the word develop. It you can develop an addiction, and as an addiction develops, it becomes harder and harder to undevelop it. Also, active listening and empathy, patience, and self care, because dealing with people with addiction is a lot of work. And that's something I learned during this podcast, the importance of taking care of yourself as someone who is helping others with mental illnesses. So, in conclusion, eating disorders and addiction, uh, they may take a lot of time and effort to treat. And as peers, it's important to be patient and take care of ourselves as well as the person we're trying to help. Also, this is the last episode in the podcast. So, to whoever is listening, I wish you well, and I hope you enjoyed these Psyche snacks.